Hello and welcome to part 2 of skull pathology. We will begin part 2 talking about facial fractures. The first type of fracture I'd like to discuss is the tripod fracture. A tripod fracture is caused by a blow to the cheek, resulting in a fracture of the zygoma bone in 3 different places: the orbital process, the maxillary process, and the arch. And you can see on this 3D reconstruction of a CT scan the 3 different fractures. So this results in a free-floating zygomatic bone, or what we call a tripod fracture. Next, the Lefort fracture. A Lefort fracture is a severe bilateral horizontal fracture of the maxillae. So both maxilla are typically involved. That may result in an unstable and detached fragment. And as you can see from the diagram, there are 3 stages of Lefort fractures. So stage 1 would be this horizontal fracture, again affecting both the right and left maxilla bones. Stage 2, you have involvement of the orbits up here by the nasal bones. And then stage 3, you have involvement of the zygoma, the orbits, part of the maxilla and nasal here, all the way to the other side. And these pictures here are so interesting how they repair them with the screws, but you can actually see that is detached there. So quite interesting and painful. Next, let's identify the term counter-coup. A counter-coup fracture is a fracture to one side of a structure, in this case the skull, that is caused by an impact on the opposite side. So for example, a blow to one side of the mandible would result in a fracture on the opposite side. Or here, a blow to the front of the skull results in trauma to the back of the brain. And it really has to do with that motion or that energy being transferred from one part of the bone to another. And this really reminds me of the pelvic ring fractures, if you remember back to the pelvis unit. An injury to one side of the pelvis can result in a fracture on the opposite side of the pelvic ring. So similar concept here. You can have a counter-coup injury in the jaw or the mandible or in the skull. Next, let's talk about foreign bodies. So a foreign body of the eye, as we know, refers to metal or some other type of fragment in the eye. And it's a relatively common occupational injury. Think about welders, for example. It's not uncommon to get metal fragments in your eye if you work as a welder. Plain X-rays are helpful for detecting the presence of a metallic foreign object, but plain X-rays are limited in their ability to demonstrate any damage to the tissue caused by these foreign objects. So before patients have an MRI, they must answer questions about any history of a foreign object in their eye, because we know the magnetic field of an MRI causes the metal fragment to move, which would cause injury to those soft tissues. In fact, even blindness may occur if the optic nerve would be severed by a moving foreign object in the eye. So radiographic images, such as the Waters projection, may be obtained pre-MRI to confirm the presence of any foreign objects. And you can see here's a Waters. I know this is the Waters because the petrous ridges are below the maxillary sinus. For the most part, they could be a little lower in this image, but that's neither here nor there. Look in the left orbit, you can see a little metallic flake here. So the Waters is a common projection to look for the orbits, and then also there's a lateral projection here, and again you can see a little metallic object here. And look at that large maxillary sinus below. So performing a pre-MRI orbits projection such as the Waters is an easy way to satisfy your skull requirement for your clinical competencies. Next, let's talk about sinusitis. So we've talked about skull pathology, facial bone pathology. Now let's talk about sinus pathology. Sinusitis is an infection of the sinus mucosa that may be acute or chronic. so new or long-standing. The patient typically complains of headaches, pain, swelling even over the affected sinus, and maybe even a low-grade fever. This is an example, of course, of a Waters projection, and this demonstrates a really nice air fluid line in the right maxillary sinus. So here is my right maxillary sinus, here is my left, and of course, look at that nice air fluid line. Here are a few more examples of sinusitis. The left image, of course, is a Waters projection, and again, you can see an air fluid line and then some layering of some fluid here in the left maxillary sinus as well. And then, of course, on the right is a coronal slice taken during a CT scan. And again, this is the osteomeatal complex that we've talked about in previous lectures. Here's the right orbit, left orbit. Here is the right maxillary sinus, and here is the left. So a normal maxillary sinus looks like this. The black represents air. The right maxillary sinus looks gray. That is all sinus fluid filling that entire maxillary sinus. So that patient certainly is complaining of congestion, perhaps a runny nose, and maybe even pain over the area of that right maxilla. So that is the conclusion of our skull pathology. If you have any questions at all, please let me know.